Drug deaths gone up once again. It's just simply not good enough, is it?
Obviously, my first message is one of extreme sorrow to all of those people who have lost a loved one to drug dependency. It's every single one of them is a tragedy, and I've been able to hear directly from family members today around the profound impact that has. But also from them around the work that they are doing, for which I'm very grateful, to support on a peer basis, support people who are currently going through the same process that they have, on trying desperately to get the support and support for their loved one to relieve themselves of that drug dependency. We are embarked on a national mission to expand the support available. We've expanded residential rehab beds. We're supporting community-based facilities and programmes such as what we're seeing today. And there's more work to be done around the carrying of naloxone, which saves lives, and drug testing facilities, as well as safer consumption rooms that we know through international evidence make a difference in saving lives. And that, what we will do is continue to support those programmes and support that expansion so that we can save lives.
More work to be done, certainly, given today's figures. But do you feel it's been a failure in terms of Scotland's drug policy because it's not working?
I believe that the programmes, the interventions that we're supporting are the right ones, which is what makes
But they're not, because they're not working.
Well, which is why today's figures are so concerning, because I do believe the international evidence, the stakeholder evidence, those with lived experience, it all points to the interventions that we're making being the right ones. Some of those interventions are still to come through. We're still in discussion with the UK government around drug testing facilities in Aberdeen, Glasgow, Dundee. We know that providing early warning signs around what is in the drugs that are being consumed makes a difference in terms of saving people's lives. We know that having safer consumption facilities in other countries has saved lives. Those are interventions that I believe are most profound, that will have an impact in terms of saving lives, alongside the work that we're doing to provide the support for people to relieve themselves of the dependency upon drugs, such as residential rehab places, such as the community facilities that we have here, that's providing value to people with a drug dependency. And that's why I believe there is hope to still see an improving picture here, as we saw last year, where we saw a reduction. This year we see an increase, but I believe the trajectory is downward.
Well, we've obviously got an increase in cocaine use, we've got an increase in people dying from methadone, so that would suggest that there's still quite a lot of work to do.
And I think this is why it's important to stress how complex this is, because people it's difficult to ascertain as to whether they're dying of methadone or with methadone. It's a harm-reducing service that's available there to try to provide support to people away from opioids that still account for the majority of the drug-related deaths. There is a complex picture, though, and it's a changing picture that we're responding to, where you point rightly to the increased cocaine use and the increased use of synthetic opioids that we know are much more powerful and dangerous, and the continued evolution of street benzodiazepines that are also in the mix. And all of that point, as we've seen in the figures today, where the deaths that are responsibility of polydrug use, when more than one drug is involved, is also incredibly high, 80%. So that's why it's so important that we look at those life-saving options that are before us around safer consumption rooms, on drug testing facilities, that I believe will make a real difference in saving people's lives.
But people who have families or partners or loved ones who have died from drugs really probably don't have any faith in the Scottish Government anymore, because the figures are so bad, they just don't believe in them.
I can understand that feeling, I can understand that sentiment, and as I say, I've been able to hear from people today on the work that they are doing to provide support to those that are currently going through what they have been through, and it is a tragedy, every death that has been the responsibility of drug dependency. I think that we're on the right path in terms of the investments that we're making, the support programmes that are in place, and the work that is still to come.
But that clearly isn't the case.
Well, I believe that we are making the right investments. I believe that we are making the right interventions. That's supported by international evidence. It's supported by expert stakeholders and clinicians that a public health approach is the right one. Obviously this year is hugely concerning in terms of the rise that's come, but some of that, we've got some of the work is still to bed in. Some of the interventions that we want to see around safer consumption rooms and around drug testing facilities have not started yet, and so that the opportunity to save lives has not started from those interventions, and that's why I hope that the negotiations on those two areas with the UK government can be more productive than they have been in the past.
And if that's the case, we can expect a reduction in drug deaths.
As we said last year, when we did see a dramatic reduction in the number of drug deaths, we're not complacent. We are fully committed to the continued expansion of the national mission, and will continue on that endeavour regardless, to make sure that we the difficulty we've seen this year, the tragic figures that we've seen this year, will continue to make those investments because we believe we're in the right area in terms of the support that's needed for people with a drug dependency.
Shocking figures. What do you make of them?
Yeah, not surprising. Diabolical as far as the families are concerned, who are constantly being let down year after year, and just shocked that the Scottish Government are continuing to stick to the party line that they're making progress when the maths quite clearly shows that they're certainly not. There was a 12% rise overall and a 25% rise in Glasgow.
I mean, that's truly shocking, isn't it? 25% rise in Glasgow is just unacceptable.
I don't understand why they continue to keep spinning this, in the way that they are, and trying to claim progress. Unfortunately, when we started campaigning 5 years ago, we had a hashtag called "You Keep Talking, We Keep Dying," and since then, they declared a national crisis, and there's been so much spin and rhetoric since then that we're actually considering changing that hashtag to "You Keep Lying, We Keep Dying."
Well, it's true, isn't it? I mean, that's the thing today. I spoke to Neil Gray earlier today. Obviously, he was under the caution, and little wonder given what we've seen, but it just seems to be the same old way all the time. Nothing ever changes. The only thing that changes is the ministers that give us the spin.
Yeah, it's almost running parallel to the addicts' journey themselves, like, when we're ill, we can do nothing until we admit there's a problem, and we can't change until we admit there's a problem. And unfortunately, the Scottish Government are still in the denial phase that there's a problem here, and trying to spin their way out of this is incomprehensible.
Rises as well. We've seen cocaine use, obviously the higher number of deaths there. Fentanyl's obviously coming in too, and more deaths as a result of methadone. Shocking.
We know from the statistics that the cocaine deaths are 40% of overall of those deaths, and we know also that we don't have any services that will treat cocaine addiction in Scotland, and we also know horrendously that drug services are now offering people with cocaine addiction methadone as a substitute. I mean, that is beyond anything that any other part of the world would be shocked at that, but yet this is commonplace in our services in Scotland, and our government isn't even willing to admit that that's going on.
It beggars belief.
It really does. It's incomprehensible, it's diabolical, and it's shocking.
What about the number of beds, obviously, for care? Because there seems to be, certainly today when Neil Gray was asked about it, he was incapable or unwilling to answer the question with regards to how many beds are available.
Well, what they're doing with the rehab beds is they're calling them placements, and they're also including in those placement figures detox beds, stabilisation beds, mental health beds, and goodness knows what other beds, So our estimation is there's probably around 100, and we're being generous when we say that, 100 funded rehab beds currently in Scotland. And my goodness, that, in fact, there was some time ago, the minister, the previous drug minister, Angela Constance, and Nicola Sturgeon said they wanted to make sure that Scotland had 11%, the European average was what they asked for, of all treatment episodes to be available for residential rehab. Now, if we had 11%, even in Glasgow, that would mean 700 beds. So if we were trying to meet the European average, for 11% of all treatment episodes. In Glasgow, that would mean 700 rehab beds. We have 23 rehab beds to serve the whole of Greater Glasgow and Clyde. So is it any wonder we see these drug deaths rise exponentially year after year after year?
Nicola Sturgeon said in 2021 that perhaps the Scottish Government had taken the eye off the ball when it came to drug deaths. Is there still a ball?
Oh my God. We're not even on the same field anymore. I don't know what field they're playing on, but it's certainly not reality. The spin that's coming out of the Scottish Government is beyond Orwellian. It's just lies, lies, damn lies, and statistics.